Assalamualaikum warahmatullahi wabarakatuh. So today is my first class as a fifth year medical student, and I just finished my fourth year exam, which includes psychiatry and specialty. And today I'm gonna start my first class of EM, which is emergency medicine. It only includes 2 weeks of the posting, and later throughout the day I'm gonna have a class on BLS, that is basic life support, and also on trauma, which we're gonna do on a simulated ward and a simulated patient. So I'm gonna show you how it's gonna be done. And before all of that, there will also be a briefing which gonna start in a few minutes. And before we start on our emergency medicine journey, I want to share a verse from a Quran, which is I will call the verse for the day. I'm gonna show you either a Quran verse or a hadith. So for today's verse, it's from Surah An-Najm, chapter 53, verse number 39, which Allah says, and that man will have nothing except for what he strives for. So this verse means that whatever we do, whatever like a success we done, it is based on our hard work and our dedication. So we have to always remember that without putting in our work, in our effort, we will not have the success or the result we want. So this shows that our efforts, no matter how challenging, we can always, there are the seeds for our future, for both this world and the hereafter. All right, so I'm gonna join the meeting soon, and then I'm gonna talk to you about how it went.
A few moments later.
So the briefing just ended, and our prof gave us a full briefing and orientation on how we'll conduct our emergency medicine and what we can expect from it. So what I learned from this is that I learned 5 terms. So in EM, emergency medicine, there are red zones, there are yellow zones, green zones, there are observable ward, and triage bay. So what are these means? If you want to see red zone basically means like life-threatening conditions of a patient, which needs immediate resuscitation as they are in a very critical state. For example, if they have like a severe trauma or like a heart attack or a respiratory failure, so those needs like immediate attention from the doctors. So for the second term is that yellow zone. Yellow zone is not as life-threatening as a red zone. It just means stable, but it means that, example, like a moderate trauma, it's not as severe, but you just need to monitor the patient. So that's yellow zone. So for the green zone is a bit more like relaxed. So it means that your patient will only have like minor injuries, like maybe like a sprained ankle or maybe like a small cut, like a bruise, and that doesn't require any immediate attention. And then we also have observable ward, which includes means you have to observe your patient basically. Like you have to check, monitor their vital signs, if there's any deteriorating symptoms, to avoid those like severe symptoms. And then lastly, we have a triage bay. Triage bay basically means that the patient is sent to the ward, to the hospital, and then they're gonna be decided either they're gonna enter the red zone, yellow zone, or green zone. So it basically like triage bay determines what management you're gonna have, and those are the things that was been taught in the briefing. So I'm gonna show you about this simulated ward after this.
So this is the simulated patient that we can practice on. So this is one of the BLS called CPR, a cardiopulmonary resuscitation. So you perform a chest compressions to maintain the circulation when the heart or breathing stops. So after the compressions, what my prof here is doing, that he ensures the patient's airway is open and clear. So he used a head tilt or chin lift maneuver to open the airway of the patient. And then if the patient still doesn't breathe, we provide a ventilation using a bag valve mask while continuing the chest compressions, as we can see. And then as you can see here, there is an AED, which is automated external defibrillator, which I just used. So you apply this to deliver a shock to restore
Everyone, okay, 3, 2, 1.
in cases of sudden cardiac arrest. And now we have now is an ECG precordial chest leads, which have the red, yellow and green color. This to help the medical staff quickly leads in the correct position during an ECG setup. Now this is an ECG showing a ventricular fibrillation. And here we now use a defibrillator, which is a biphasic defibrillator. You start with 200 joules, depends on it, and then we press the charge button, as you can see the yellow button there. And then after that we have to say clear, so that to make sure no one is touching the patient or the bed. And then we press the shock button on the defibrillator to deliver the electric shock. Then immediately resume the chest compressions. Now my prof is showing how the upper airway muscles, such as the tongue and pharyngeal muscle, can collapse and obstruct the passage of the airway. Now it's a patient with a head injuries, so how to intubate them is you have to be careful first, because they have a potential of cervical spine injury. So this process is called a rapid sequence intubation, or RSI, where you involve sedating and paralyzing the patient to secure the airway as quickly and safely as possible.
So you have to keep the manual immunization. So you kena keep macam ni lah. Kalau you lepas dan gerak, then cause more injury to the spine. Okay. Otherwise.
And now we are giving a rigid cervical collar to immobilize the neck. It is a main reason to stabilize the cervical spine, as you can see.
It should be, ini supposed to be disposable, tapi dah good.
And lastly, we have a traction splint. So this is used to immobilize the fractures. So this stabilize the limb in a fixed position and maintain it to prevent further movement of a fractured bone.
Alright, so that marks the end of the video of my first day of emergency medicine posting. So take care, and inshallah I will see you in the next video. Assalamualaikum.